I want to start our conversation by asking you why, after 3 years of dealing with this pandemic, of locking ourselves up, of changing our lives and our behaviors, living in fear of getting sick, of losing someone for 3 years, why now do we want to read a book about it?
Because we literally, as you have kindly put on the cover, we are not okay. We had this conversation over lunch talking about how this pandemic, with my book that you published first for me about Welcome Back and rebooting your physical and mental resiliency. And I realized that we're really not even there yet, and there's needs to be a conversation. Now, I've been at events where I have always said that this pandemic has been defined by the numbers, right? Statistics. You'll hear 7 million people in the world died of COVID. That's 1% of the global population. Over 1 million Americans died, and 50,000 Canadians passed away. Now, what it means for us in Canada is that every day, one Airbus drops out of the sky and everybody on that plane has died for 1 full year. We would have never allowed that to happen. And now we have 78, so that's like one small of those little Bombardier planes going down every day.
That's still a huge number.
It's still a huge number. Mm-hmm. So that's the death toll, I would call it. And as we were researching this book, we discovered that there's an undercounting. And it's probably at maybe anywhere short of 3% to 30%. Okay, so that's the dead data, so to speak.
Mm-hmm. But that's 3 to 30% more dead people than we've actually counted.
Yeah, because early on...
Just not attributed to COVID.
That's right, because early on there was no screening tests, and if you weren't really sick and you had a heart attack from COVID-related things, that was deemed a heart attack and not because of COVID, because you didn't have a diagnosis, because you didn't get tested, especially if you were up in nowhere land where you wouldn't even get a rapid test, right? Mm-hmm. So nobody knew what you had.
Right.
So this other second area that you and I have always focused on is that it's really important to do what you would call an audit, right? Of the physical, the mental, and the social ramifications of individuals, companies, and our society, our country, the world. And it's each of our responsibility to do that so that we begin to recover. Because any crisis should require an audit. And we've just kind of moved on when actually there's a lot of consequences that I think we're going to want to talk about right now.
Right. And just to be clear, it's not really over. People are still, I saw the number like 50,000 new cases, I think it might have been a week or something, or
globally?
A month. Yeah, but anyway, lots of new cases.
Yep.
People still dying, people still suffering consequences
Still getting sick.
Long COVID, which lasts a lot longer than people suspected that it would. And as you say, the mental health consequences and the social consequences as well. Now, in order to understand those consequences, one of the things that you wrote about that I found fascinating was that it's all related to inflammation. Best of you describe how inflammation results from COVID-19 and the ramifications it has, the lasting ramifications that it can have.
Thank you. So everything is an itis, I-T-I-S. So something in front of it, itis. And essentially, when you get an infection, your body tries to get rid of it. So it fires out everything it can to flush it out. And when it doesn't work, and sometimes it obviously has worked, it doesn't work, you die from organ failure of some sort. If it does work, sometimes it causes such a response that it damages the organ in some organs, and that's how we get complications related to COVID. And that's why I think that there is an under-awareness or a lack of fully of the impact still going on right now.
So give us some examples of the complications.
Right, so if we assume that, and it's not really today, I looked at the stats, 60 to 70% of people below the age of 60 got COVID, and about 40% of seniors have had COVID. So that's a lot of people beyond what we call the traditional long COVID. So let's just talk about the different parts of the body. It's the brain, it's the lung, it's the liver, it's the kidney, it's the joints, it's the skin. And just give you a personal story, my son got COVID after the second round of shots, and that was Omni, and it was late in April. And then in July, he broke out in all these kinds of weird rashes, and it's my kid now with all the rashes. Mm-hmm. And beyond not finding a dermatologist, a friend that would even see him, when they did, they didn't know what it was. And in retrospect now, it was long COVID. It was related to that. So I wouldn't call it long COVID. It was COVID complications. It happens months later. So let's talk about long COVID.
Sure. What is it?
So long COVID is a cluster of symptoms that our medical community has deemed as related to COVID, but we don't necessarily have correlatory blood tests, x-ray tests to prove that you have long COVID. Some people obviously do. And symptomatically, most people think that long COVID is related to shortness of breath and wheezing because it's a lung infection. Mm-hmm. In fact, that's only about 15% of the symptoms. 25% of people literally say that they have fatigue, and the other 20% they have brain fog. So between those two things, half of long COVID is these abstract symptoms. And then only aches and pains, sleep impairments are low on the totem pole. And before we had this event, I had my classmate come, and you'll see this on one of our videos. He literally had every symptom, enough for him to be former chairman of the Department of Plastic Surgery at Toronto Western. He has to retire because he actually got long COVID after he had an infection after 4 shots. So it's just been recent. And so that
he's
takes
fully vaccinated, boosted,
fully vaccinated
everything.
and boosted. And he says, I think it's because I was burned out and exhausted. And then my body was too weak to fight a regular infection along with some maybe genetic predisposition. So,
and he's a healthcare worker.
That's right.
You mentioned that healthcare workers were particularly susceptible.
I asked him, I said, so do you think it's a created media story that healthcare workers are burned out? He said no, and actually a lot of my classmates are retiring, and I was actually shocked to hear it from him because they're in the teaching hospital. So when we have a crisis already in our healthcare system and you overload this now with long COVID and overload it with other healthcare issues, which is also in this book about access to care, we end up with a system that's beyond overloaded and it's just fracturing. It's like, I would say like the iceberg just melting into the water, and the mess is all over the place. So
2 of the organs you mentioned, the lungs, I think people understand that intuitively from the virus. It just makes it hard to breathe, and the brain fog is a well-known symptom. But how can it affect your heart? How can a aerosol virus affect your heart?
Yeah, so one of my patients in his 30s, and he's actually totally healthily functioning in terms of fitness and exercise. But it's because he's a young heart. And during, he's been vaccinated, he got COVID, and he got myocarditis, inflammation of the muscle of the heart, muscle carditis. He whacked out 30% of his heart muscle. So right now, he goes to the gym, he can do everything. But I think he'll be one of these folks at 50 when, if he's not fit, he's going to need some sort of a heart transplant.
And that's from COVID?
That's from COVID.
So the part of it that I found most disturbing, because, you know, like a lot of us, I'm a knowledge worker, and the idea that COVID's parked in my brain and is going to be there for a long time is really scary.
I know, this is the new finding that we, and by the way, thanks to Ken, we got a huge op-ed piece in the Globe and Mail. I think most of you here have read it. They've discovered in people who've had COVID, whether it was mild or severe, and they didn't die of COVID, but say died of something else, and then they decide to examine their brains, there is spike protein embedded in the brain tissue of these people. So think of you having a piece of glass in your foot, and you keep walking on it, it hurts, and it gets inflamed, it gets red. Well, some people are walking around with bits in their brain of COVID protein. Is it you?
I think I'm one of them, yes, yeah. So if that means that because of COVID, a lot of us have effectively, essentially, an inflamed brain, does that explain a lot of the strange behavior that we've seen in the last few years? And by, I mean unusual behavior. We've seen high levels of people with mental health problems. We've seen a lot of people acting out on the streets. We've seen unusual levels of anger and discord in society. Is that a cause, or is that something we can attribute to just the ordeal of the pandemic and the lockdowns, or is that possibly aggravated by this inflammation as well?
I think that's an added reason. And Dr. Chin, who's a psychologist, is nodding. We taped a segment before this talking about the fact that this pandemic has been a trauma for everybody in this room, even the animals in our society, because you may think you're not traumatized, but you may have been micro-traumatized. And if you add a whole bunch of them together, it becomes a bigger trauma.
What's a micro-trauma?
So micro-trauma might be inconveniencing you. Every time you got to go out, you got to put a mask on, right? And if you forget it, you have a panic. To a big trauma, somebody in your family passed away from COVID. But if you add a bunch of this, and then it's like lockdown 1, lockdown 2, lockdown 3. By the way, Ontario was the most number of lockdowns anywhere in the world, by the way. Lockdown 4s. And each time it impedes us to do christenings, weddings, graduations, funerals, celebrating a birthday, just hanging out, right? Those are all different types of traumas that are not necessarily physical traumas, but they're social traumas. So the other side of that is having a conversation about post-traumatic stress reaction. So I love this story that I read, and we put it in the book, about the analogy of people going to war and coming home. They're in the theater. Each of us, everybody in this room I know, had a role to play in making sure that we all got through this pandemic, whether it was at the city level, at the banking level, at the teaching level, at the mother level, father level. Every one of us have played a role. Then all of a sudden, we had lost that, and we don't know how to behave anymore. And that even includes coming back to work, as we call it. And it's a reaction, and it's a bit of the trauma reaction, and we then have grieving. So there's a couple of cycles of grieving. So I'm going to put the bucket of the rage under the bucket of denial and shock. So it's much easier to say there's no COVID, and then when you extract it, therefore if you have no COVID, some people I'm sure would say, well, then I don't need to get vaccinated. and then you just double down. Because if I don't get vaccinated, it will maybe go away. It's unconscious. Now, I'm not saying everybody did that, but. And then the bargaining piece is all about making do with the situation. So overeating was one, gaining the COVID weight. Everybody in this room probably has learned how to get COVID weight. And then there's also the situation around, I believe, hybrid workplace. I think people are doubling down as part of their bargaining tool in their grieving recovery. Because some of it's unreasonable.
So their reluctance to go back to the workplace
is
is
like,
a response to...
I need to stay at home. Like, that's my comfort zone. So it's like some soldiers, they're more comfortable going back to the war zone than to come home and stay with their family because they don't know what that family composition looks like anymore. Like, that's foreign to them. And then the final one is depression and anxiety. Like 1 in 4 people have a mental health issue before COVID. Then you compound 25% more of people with with COVID, long COVID, have depression. So now people like Dr.Chin are not just overworked, they're just overwhelmed. And we have people left on the side, not taking care of themselves. So this book is trying to say we're not okay. Get through your grieving pieces, get some help if you're stuck in a phase. Otherwise, we can't resolve to get to a place where we can just really move on as a society.
So we've talked about some of the human consequences of the pandemic. When you look at our healthcare system in particular, it had a rough ride, especially early on. We didn't have enough beds, we didn't have enough personnel. The whole system was overwhelmed, and it never really recovered, did it? And there was a lot of treatments, a lot of screenings missed over 3 years, and a lot of burnout, as we discussed, with healthcare workers. And so where are we now after the pandemic with the healthcare system?
So I'm just going to get you these numbers. The Fraser Institute just put something out in December. I just want to make sure I get the numbers right. The average time from somebody like Dr. McGregor and I saying you need to see a specialist to the time to getting to the specialist to getting care, 27.4 weeks average in Canada. It's almost like 50 weeks in some of the other places in Canada.
So almost a year.
Yeah, and it was 25.6 weeks in 2021.
Which is not very good to start with.
And so when I started practicing, it was around 10 weeks. So Dr. McGregor and I talk about the fact that we're like, she's more frontline than me. I'm privileged to be working with a lot of you, and I've kind of modified my practice. That she's working, I hope I can tell, till 8:30, 9 o'clock at night, like finishing her job, dealing with her family things, and then getting back to documenting and doing other work. That it's just, it has become not sustainable. Now, 90% of women did not do their mammograms in 2020. And 85% of people didn't do their colonoscopies in 2020. And I can tell you that I had to pull teeth to get everybody to go, but I guess I have a little tiger doctor in me, and the patients are more scared of me than to not go. So they went. Diagnosis of lung cancer decreased by 47% and melanoma by 67%. Just to give you some examples, and the NIS in UK estimates that 10% of women are going to die as a result of delayed mammography and like a more advanced illness. So
the fact that those people missed those screenings in 2020.
Cancer didn't wait and say, we'll take a stall, we'll take a pause. And that's just cancer itself. And so you're wondering why. I have to say that our clients, I've had 3 cancer patients, and they were living in the US at the time, and I said, well, I guess it's time to spend your money. Because A, you can't come home, and B, you got to get care, because we just can't get that going right now.
So cancer's one part of the puzzle. talk about the rest of the healthcare system. What have the other impacts been?
Well, we have retiring doctors, we have retiring nurses, just when we need them. We have even, Dr. Chin was talking about, when kids need help, they can call a kids sick, like a kids crisis line. Mm-hmm. But that's even getting overwhelmed. They were overwhelmed. So I guess what I'm saying to you is that if I have a takeaway is that we are not okay on an individual level, on a business level, because we don't know how to make this hybrid workplace work efficiently, if it really is supposed to work efficiently. And there's lack of socialness, right? And that's so important. We're social animals. I always say, if you go in the zoo, do you go to the zoo?
It's been a while.
Well, remember when we were kids and we
Yeah.
took our kids? Mm-hmm. The chimpanzees hump on each other all day and night, right? Mm-hmm. And the apes are grooming each other. We've learned to just hang out in our homes and it feels safer, but it's actually unhealthy. So on that note, I applaud all of you coming out, and it's healthy for you. It really is. So we just have to learn how to take care of ourselves now. Fend for yourself.
So we've talked about the fact that people are still sick, people are still dying. There's a lot of long-term health consequences from COVID. There are a lot of long-term consequences from all the treatments, screenings, et cetera, that were missed during COVID. And now we have a healthcare system that is overwhelmed and just when we need it most, less able to help us than ever before. So how do we move forward as a society? Is there a need for some kind of official audit, official reckoning with the whole COVID experience and how we did? Do our governments need to be reviewing their performance? Do we need to be looking at the whole of the healthcare system and talking about how to get it fixed, to get it right? What are the next steps?
So I think the next steps would be that you get back into the public domain and publish a series of articles to do an audit. That would do the trick, because here's the reason why. I think there is no politician on this earth that is going to do an audit on themselves, because truthfully, by and large, we all tried our best. There was mistakes made. And if anybody reads the World Health Organization report, it's kind of done. So I would prefer that we do an audit moving forward. Do we still have enough masks? What is our solution to
Enough mass of
masks?
masks. Okay.
All the ones that we had were expired. And some of them were actually thrown out and never brought back. Mm-hmm. Do we have enough vaccines to take care of our own? Do we have enough of anything? Drugs, medications? Let's start there in terms of managing COVID. Do we have screening tools? Are we leveraging, here's the bad word, artificial intelligence to be able to predict models of what's coming aboard? Because there will be another pandemic, whether it's a lab leak or it's because of zoology and that viruses are jumping to man. I don't really care which one it is. Obviously, it's one or the other. So I'm not here to be a police officer. I'm just saying, are we ready to do with either one of those? So we need somebody like you to keep writing articles about, are we ready, and do investigative reporting.
Well, you wrote the book on it, so I think that's your next job.
Okay.
So we're going to open the floor to questions. So anyone who has a question, the microphone's right there. Please step up. And in the meantime, I just want Elaine to elaborate on that last point you just made, that scary last point that we may be facing at some point another pandemic. Is that a sure thing?
I was in a hospital when SARS happened. Mm-hmm. We just want to ignore that. Then we want to ignore the avian flu. Remember all of us running around getting our kids vaccinated, and I had drugs, and then everybody had to shh, and then everybody came into my office on a Saturday and Sunday, and we vaccinated all the kids. You know that story, right? Mm-hmm. So it's happening in Ebola. Like, it's happening more than, shh, don't tell anybody, shh. And then everybody's trying to protect their own, image. So
it's not going to be 100 years.
No, I don't think
No.
so. Hopefully after we kind of.
Right.
But then I'm doing longevity medicine with you, and we might see it. Gord, you're going to ask a question.
So the takeaway here is we're not okay. And you've gone over the number of people who died, the residual health issues, the healthcare system, et cetera, et cetera. So in order to get okay, we have to get a grip on our personal well-being. In other words, if you need to do a blood test, if you need a colonoscopy, if you need breast screening, you have to take the bull by the horns and do it yourself. Don't wait for the healthcare system to badger you into doing it. Just take the initiative and do it yourself. And that way you can take some of the load, perhaps, off the healthcare system and, be your own kind of health specialist.
Thank you, Gord. Very important point. All of you here know that I'm a proactive, preventative, personalized medicine physician. And that means that at this point, it'd be nice to have somebody badgering you, but there's nobody badgering you. You actually literally, it's not going to. There's all these odd things like you're not the age group. Like somehow magically at 70, you're going to stop having colon cancer, so you don't need a screening. Somehow magically you only need a bone density test because you're magically 60, and all these other restrictions, and actually you don't need a checkup anymore because at one point we thought you needed it, but you don't need it because you age. Bottom line here is you need to be proactive. You need to know your numbers. And then the second takeaway is take those numbers and do something with them. If you don't know there's a risk to it, then you're with the wrong health professionals. It doesn't need to be a general practitioner. It can be an integrated health professional, which I do work with, naturopathic doctors. It may be a psychologist because you are exhibiting mental health issues. We were talking about kids being more isolated, and then that means that there's something changing. Adults do the same thing. Get some help, and you need to take care of yourself. So thank you.
Be more assertive.
Yes, self-managing.
Okay.
Thank you. Anybody else? This is Barry Cooper. Is that okay? If you don't want to talk about the fact that you're Barry Cooper, they'll cut it out.
I'm Barry Cooper, and happy to be a patient and friend of Elaine's for many years. So it strikes me as COVID is never going away. It strikes me as though it's a bit like the flu, only perhaps a more dangerous aspect or a dangerous type of flu. Every year we get a flu shot, and it's a little different than the year before because they best guess at the strain. And are we now essentially faced with dealing with COVID forever? And is this something that is going to change from year to year? But notwithstanding all the precautionary things we have to do as people, are we kind of living in a world that this is an ongoing issue we'll have to deal with essentially for the rest of our lives?
Short answer is yes. They've already planned to probably put both the COVID vaccine and the flu vaccine at some point together. I think that will be happening. So that's the short answer. But the longer answer is that this book really, and you just said it's going to be with us. I think conservatively, it's like 15% of people have long COVID. And just by going through all the different signs and symptoms, it's dramatic to think that maybe at least 1 in 4 of us sitting in this room have some related long COVID symptom. And then if you think about all the people with permanent damage to their organs, and they're young, the knock-on effect is there. The knock-on effect in the next 10 years of cancer care and cancer deaths, and it just goes on and on, along with, as the bankers would say, we're in a retirement generation, right? And that group is going to use up so much healthcare. By the way, it's you and me. We're the tail end, and we're going to eat the living daylights to the bone of the healthcare system. So some things need to change, and it starts with each of you, because each of you sitting in this room, I know this for a fact, you are thought leaders and leaders in your community, and we need to start advocating that we need to start doing more in terms of not just auditing, which is the first place to start, but do your self-audit, do your organization's self-audit. And I'm going to make a humble ask is that if you are in an organization that doesn't want to hear about these complications, I will come and do a lunch and learn. All I ask you is to buy the books from Ken, and that's all I need, and I need lunch. That's all, right? I need you to help me spread the word. Ms. Cortez.
Hi, Ken. Nice to see you again. So your book is We Are Not Okay, but are you hopeful for us and for the next generation?
Whoa. Okay, so I am more hopeful. See these people over here? These are the young people that I work with, and they're working to do a couple of things. So Chris is helping me have a conversation with the world, and 2.5 million people watched a video about me talking about how barbecue foods causes cancer. In case you haven't watched it, you need to watch it because it's important. And there's plastics in our bloodstream from drinking plastic bottled waters. Annika is over there talking about non-alcoholic drinks and the need to not fry our brains, fry our liver, fry our bodies, and the fact that we can have a non-alcoholic option that's just fun and socially responsible, which, not to mention all the knock-on effects of alcohol. And because you're not healthy, most of those folks ended up in the ICU. And then there's the two other gentlemen who's helping me create our smoothies, integrating alternative milk powders to reduce our carbon footprint. So this generation is going to show us up. Okay. You have a kid, right?
Yeah.
She's pretty.
I hope they do.
They do. Mm-hmm. So, and so is your kid.
We're already doing it.
They are. And they're standing right there. I need you to understand that 3 people right here, Tina, Gord, and Ken, have given me my voice. Tina gave me the first opportunity. I met her first at the Marilyn Dennis show when it was still on City. Then this lovely lady created CP24. And it's never been the same since she left. I've told you about Gord giving me a voice, and I need to explain to you how I ended up with a book. So the first book was a dare. Some of you know this. He vowed to never eat fish. And if you guys all know in this room, omega fatty acids are extremely helpful for your brain and your joints, right?
Yes, they are.
Because you're an intellectual, right? He goes, I will never eat fish. And then I said, I hate writing, I'll never write a book. Because every time I say, can you help me do an article like about me? And he goes, no, you need to write a book to tell your story. So he then put a bet. If he ate fish, I would have to write a book. And I took him up on this bet because he never does anything I ask him ever until lately, more so long lately now. And he ate fish. And he took me to lunch and ate salmon. And I ended up having a write
We're
a book.
both better for it.
I know.
Yes.
So this is where the stigma of being a Chinese girl in a Canadian society where every year the first term I would get a B+ in English, followed by an A-, followed by an A. And I decided that I was bad at writing. But I was pretty bad at writing. Then the second book, he said to me, it's better than the first. Actually, it's pretty good. And then he said, I said, am I an author now? And he said, no, you need 3 books to make you legit. So because of him, I'm now legit. And just in case you're wondering who sent me to the principal's office, it was Tina who sent me to the principal's office. And I have the 3 of you to thank to make me who I am beyond a competent doctor, but to be able to communicate to other people here. So you are fully responsible for my non-medical career. So thank you. So I think they need a round of applause for me.
Well, I just want to say in closing, Elaine, that you're welcome, but we have all gained so much more from you, from your very intelligent, thoughtful approach to healthcare, both for us who are your patients individually and for the community that you're in, and your leadership on these issues, and putting yourself out there time and again on these really important issues and causes. And I am personally grateful for your leadership on that, and I know everyone else in the room is, so thank you very much.
Thank you to all of you for coming today.
And congratulations.
Thank you.